Hello everyone. Today we'll discuss about cystoscopy, which is a very common procedure in an urologic clinic and very common urological procedure performed by the urologist. Well, cystoscopy is a procedure, endoscopic procedure, where the inside of the urethra, that is the tube which carries urine from the urinary bladder to outside of the body, and the bladder, inside of the bladder is the reservoir of urine. When urine comes from the kidney via the ureter, is deposited inside the urinary bladder. So inside of the bladder and inside of the urethra can be very well visualized by this beautiful endoscopic technique called cystoscopy. It can be a flexible scopy or a rigid scopy. It can be done under general anesthesia, spinal anesthesia, or local anesthesia. A cystoscopy is done to diagnose so many things like unexplained hematuria, unexplained lower urinary tract irritating symptoms when patient is not relieved by medical treatment. So when we introduce the scope, we can see inside of the urethra, like any urethral narrowing or the enlargement of the prostate gland or any stone inside the urethra, or in the bladder also we can see the mucosa, whether there is signs of inflammation of the bladder, any tumor, and the condition of the urethric orifice, the bladder neck, and presence of any urethral or any bladder diverticula. Here we are coming up with a rigid cystoscopy, the patient under short general anesthesia. Let's see the video. Patient in lithotomy position, you can see the scope is going in. We are using Cystos's 30° 5mm scope and a cystoscopic seat which is 20 French size. This is the bladder neck and this is the interior of the bladder. A small clot is visible which is moving, and we will systematically we will see the urethric orifice, the right and left, and then bladder mucosa, whether there is any evidence of inflammation, bladder diverticula, or circulation, trabeculation, or presence of any bladder tumor. If there is any stone is there inside the bladder, that is also very well visible. Here you can see the bladder, small bladder clot is there. Otherwise there is no any evidence of inflammation, no sense of tumor, and no visible tumor. Rather, in this copy you can see the neck, bladder neck, which is wide open. The prostatic urethra, you can see the prostatic urethra showing some kind of inflammation there. While coming out, we can see after the prostatic urethra, you can see the verumontanum and the external sphincter, which is quite well visible, but there are some signs of inflammation at that urethra. In the prostatic and in the membranous urethra, there are some signs of inflammation. That may be the cause of burning urination and frequency in this patient. The rest of the urethra is visibly normal. That concludes the cystoscopy in this patient. So this is a beautiful technique, endoscopic technique, to see inside the urethra, to inside the urinary bladder for presence of any tumor, stone, infection, inflammation, diverticula, or narrowing of the urethra. So it can be done by any local anesthesia or spinal or general anesthesia by using a flexible or rigid cystoscope. Thank you.